15 years of leading safety improvement initiatives in partnerships with patients and families. Our second speaker is Mrs. Amal Al-Hassani. She's Associate Executive Director of Innovation, Director of Marketing and Events at Mecca Healthcare Cluster. Amal has been working in innovation and management since 2015. She is skilled in training, facilitation, and ideations. She is actually working with innovation in how to make improvement project related to patient and healthcare providers as well, and certified in innovation as well as King Abdulaziz Quality Award. She has participated in a lot of national hackathons with engaging participant and customer experience as well. She has been trained more than 3,000 innovators over the past 5 years in her experience. Finally, her major interests are design thinking, customer experience, and content marketing. Our last and lovely speakers, Melissa Childrick. She's a patient and family advisor at ISMP Canada. We're going to take you today to the objectives of highlighting the fourth strategic objective related to patient and family engagement in the Global Patient Safety Action Plan. And we will be discussing the impact of engaging patient and as partners in safer care, and share with you the success stories of a real hands-on improvement project, national, international as well. And before we are going to start an amazing webinar, let's know from you as a participant. Where are you from? What's your name? If you can just share with us through the chat your name and which country you are from. So we're gonna have like an overview of you as participant. Have you ever heard or are you familiar with Global Patient Safety Action Plan? Okay, thank you, Omar, Maha, and Ayman. So we have diversity from different countries, GCC, Middle East, Saudi Arabia as well. Egypt, Canada, Iraq. Okay, how about the other participant? Can you share with us your name and which country you are from? UAE, Dina, Ruwaida, Ria, and Dima from Saudi Arabia. That's quite interesting for the speakers to know that we have a diversity of people coming and joining from different countries. Thanks for participants who are joining from different time zone. Let's share the other question or the second question. Are you familiar with the Global Patient Safety Action Plan? If yes, just press 1. Global Patient Safety Action Plan. Are you familiar with it? If no, you can choose 2. I think Iwana, you can see the answers now. So those who are not familiar are more than who have an idea about the Global Patient Safety Plan. Have you ever co-designed or work with a project engaging patients and families? If yes, just write one. That's going to be an interesting session. So we're going to have an expert people who could share their success stories and projects of how to engage patients and families within healthcare sector. Okay, that's great. Through Advocacy Council. I think it's time to give the floor to Ioana, our first speaker. Ioana, the floor is yours.
Thank you so much, Mikia. Hello, everyone. How are you today? I really hope you're as excited and honored as I am to be in the company of passionate safety leaders from around the world. It sure is special for me. Will you first join me in thanking our host, the Saudi Patient Safety Center, for doing all the work behind the scenes to bring us together? It's quite a lift, and I want to appreciate them. And I also want to appreciate our colleagues at the World Health Organization Patient Safety Unit for their relentless vision and leadership. Because of their work, we are here today. During our time together, I will highlight a little bit of the Global Patient Safety Action Plan, offer a few complementary resources that I think will help you, and provide 2 examples of implementation. But before we get there, please indulge me a brief side story. Today is a really special day in Canada, and I want to speak about that. Next slide. Today, many in Canada have the day off because we are reflecting on the National Day for Truth and Reconciliation. The day honors the children who never returned home and the survivors of residential schools, as well as their families and communities. Public commemoration of the tragic and painful history and its ongoing impacts is a vital component of the reconciliation process. As part of this reconciliation, we honor the traditional territories upon which we live. We do this because we recognize that the standard of living we enjoy today is the result of the stewardship and sacrifices of the original inhabitants of this land. Also, this is one way we commit not to repeat the past mistakes and work towards a more equitable and more respectful relationship with our Indigenous people. I am joining you from Treaty 6 territory, also known as Edmonton. If you're comfortable and would like to share an acknowledgement, please do so in the chat. But the concept of truth and reconciliation has significance for our work. When we acknowledge the truth, it's heavy, but the actions we take after that can be uplifting. But sometimes it's really hard to know what to do next. So that's when a roadmap is quite helpful. Next slide. I see the Global Patient Safety Action Plan as a roadmap that can lead us to a common vision, a world in which nobody is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. This is the vision statement of the action plan. So the plan is in essence a framework that we should align with. It will help us improve or maybe even begin our own plans in our own communities and countries. So in essence, we have to adapt it to fit our local circumstances. While the plan, you see there, it has 7 goals on the right-hand side of the screen, is big. Today, we're focusing on the 4th objective, which is the patient engagement. And there are 5 strategies. You'll hear from the examples that follow that can be linked to the plan and will help you advance it. But I'm not going to spend a lot of time with it. I want to focus more on how to adapt it. There's many methods. Some of those methods you are already familiar with. They include engagement of patients and families or stakeholders, change management, or improvement methods. And there's also newer methods like design thinking and appreciative inquiry that can be used. The method is not that important. You just need to choose something that you and your community is familiar with and build on, but you'll have examples. So here's my first example. It's actually about this action plan. This plan was co-developed by the World Health Organization and the Patients for Patient Safety Global Network, and it is an international guideline, so perfect fit for today's webinar. So the story begins in 2004 with the launch of the World Alliance for Patient Safety, an event hosted by the World Health Organization and included patient partners. Similar events followed every year, and more patient partners were involved. All of this culminated in 2006 with the Patients for Patient Safety London Declaration. It is a pledge for partnership that still unites an increasing number of patient partners from around the world. They are the members of the Patients for Patient Safety Global Network. Over the years, the World Health Organization nurtured and strengthened this global network, but at the same time, engaged the members of the network in the development of their resources, policies, campaigns, challenges, and ministerial summits, and so much more. So all of this work led to the creation of the Global Patient Safety Action Plan, the World Patient Safety Day, and today's event, right? And so I hope you agree that World Health Organization is a role model for us in co-designing international policies and guidelines. And I hope you also agree that the impact of this co-design is already significant. Today's discussion is a sign the extraordinary ample activities in countries around the world. This World Patient Safety Day a few weeks ago is truly unprecedented. I haven't seen anything like that in my career. So I'm excited about what comes next. There is a report for those of you who are interested about the progress of this action plan on the WHO website. But the key lesson that we can draw from this is that engaging patients is not happening overnight. It's not a one-time event. It starts small, maybe with one person, one idea, one action at a time. And then as the momentum grows, it spreads to more people, more organizations, and of course, around the world. Our actions amplify this momentum. But I know you're wondering, what can you do in today's context? There seems to be no time, no resources, and the healthcare workers are not only in short supply, but also burned out. The managers and leaders, they can barely cope with what's expected of them. Yet everybody goes to work every day trying to deliver safe care, because safe care brings joy at work. If you've been there, you know it. Thank you for recognizing the hardship. I know this is today's reality. Developed or developing country, it doesn't matter. So what can you do? My suggestion is to start small. Start by celebrating what's already working. I'm confident that if you look for it, you will find it. So for example, in Canada, we can find co-designed resources and leaders at every level of the system. We start there, right? Then ask those people, what can be done together to take things just a little bit further without adding a burden on anyone? Even the smallest action matter. Things like sharing a story that you've heard, something that inspired you, that can reinforce what's already working, right? My suggestion is for you to try to engage those who are not heard, those who are most vulnerable. People you probably are not comfortable sitting in a room with or in a meeting, because progress starts in that uncomfortable moment. I know from my experience in engaging patients for more than 15 years, it's uncomfortable, but you work through it, you get to the results, to the co-designing that resource or policy, and it's joy for everybody, trust me. And finally, reach out to this global community, all of us in this room and in other spaces, and leverage this plan, the objectives on this plan, to get over that discomfort, inspire people, and gain the necessary momentum. So this is my first example with the Global Patient Safety Action Plan. Next slide, please. I have a couple of resources I want to share with you. This table comes from an OECD report created for World Patient Safety Day this year. You see, it provides examples of degrees of engagement at different levels of the system. You probably have seen something similar with this. If you already use a resource like this, don't change it. The point is you have to strive for deeper and deeper levels of engagement at more and more system levels. The example I provide you is at macro level, right? The bottom row of the table. But what happens at one level in the system influences all the other levels. The Global Patient Safety Action Plan was built on what was done already at clinical and organizational levels and country levels. And now, in turn, this action plan will influence, again, organizations, countries, and practices. So instead of a table, think about this as a very dynamic and interactive system. Next slide, please. It's from the same report. This is a list of actions that have been shown to maximize patient engagement in patient safety, and it compiles information from countries around the world. I thought you might be helpful as you consider what would be the smallest, most feasible, and most impactful action you can take. Please have a look at this report for more information. You will have the slides with the links. Next slide, please. This is one final resource that I have for you. It is a visual from the Engaging Patients in Patient Safety, a Canadian guide co-designed and co-developed with Patients for Patient Safety Canada. This visual is an illustration of the most common way used to engage patients. It starts with developing a community of patient partners. So when there is an opportunity to engage, you have people to reach out to. Share that opportunity, the request for participation, and identify the best people who match the request. Afterwards, you support those individuals to participate in developing, co-designing a guide, for example, or whatever it is, while aiming for equity and diversity. You do need different voices in order for this to be successful. Then, when the activity is completed, it's evaluated, draw lessons learned, and improve the entire process as applicable. More information about this is available in the guide at the link on the slide. And there's a lot of good references. You'll see the link will take you to the Healthcare Excellence Canada website. A lot more resources are available there. And my final story. On the next slide, I choose a Canadian example. I mentioned a little bit earlier, Patients for Patient Safety Canada. They are a world-renowned patient group. They are individuals who experienced unsafe care, and they are the Canadian arm of the World Health Organization Global Network. The volunteers, in partnership with many organizations, have shaped policies, practices, and standards and programs at all system levels. So way back in 2006, when Patients for Patient Safety Canada was created, it functioned as a patient-led program of the Canadian Patient Safety Institute, which is now Healthcare Excellence Canada. The leadership of the Institute really believed that we can't talk about patient safety without patients at our side. So they invested in the growth of the group and engaged them in all of our initiatives. So Patients for Patient Safety Canada were part of the teams who shaped the Canadian disclosure guidelines, the incident analysis framework, and so much more. But you see, the point here was to elevate, bring out the truth about harm. And because if we do that, it will facilitate learning, healing, and improvement. Patients also co-designed and co-delivered capacity building programs that were based on those incident response resources that I just mentioned. That wasn't enough. Obviously, they had to go upstream and create awareness to the public that patient safety is an issue and create momentum in those who have not yet been harmed so they can join the cause. We did that in quite a creative way, and that happened because we allowed patients to lead us and tell us what they think is most impactful. Those initiatives are the Heart of Healthcare Art Gallery. It was a way to engage the hearts and minds of people who usually would not heard, with stories that are sometimes hard to express in words, but they can be expressed in art. And the Mutual Healing Project, which is an idea to bring together, as part of the disclosure and incident management process, the patients and families, as well as healthcare workers who have been involved in an incident, in an honest, truthful conversation, because that leads to healing. So this example shows that the partnership between an organization and a group of patient partners is a pretty powerful way to improve patient safety. It illustrates the 5 goals of the Global Patient Safety Action Plan and touches on the best practices from the OECD report. So I'll close on the next slide with a small, short reflection on reconciliation, where the essence of it is actually about mutually respectful relationships. We know how to build those mutual respectful relationships in patient safety, and it's the point of co-designing everything with patients as partners. So this is my brief presentation. I look forward to your questions in the chat. On the next slide, I have a thank you and my contact information. And now I'll turn it over to Mekia. Thank you.
Thank you so much, Ioana. Actually, we are so lucky to have a passionate leader and a passionate, really patient advocate who was emphasizing and giving us the fruitful experience from her long years experience. Thank you so much for having this small session and enlightening us. Now coming to the next speaker, Amal Al-Hassani. She will be presenting the concept of design thinking, and you're going to be amazed by the real lessons learned and hands-on experience from her side. The floor is yours, Amal.
Okay, thank you, Ms. Mekia, and also thank you for Ms. Melissa for your impressive and interesting presentation. And let me start by the next milestone. We have the how can we implement the concept of co-design methodology in improvements project related to patient experience and patient safety. First of all, I need to clarify what is co-design and what are the main methodology that we are used in our improvement project. So co-design is a process characterized by involvement of different people, different point of views, and multiple stakeholders in the design and development of a product, services, or system, with the goal of creating solutions that are more relevant and effective and satisfying to the people who will use them. Also, there is another concept that are related to co-design called human-centered design, which means places people at the center of the process, but the co-design actively involves people in creating solutions that meet their needs. By its very nature, the co-design process is collaborative methods. Some examples of co-design solutions: collaborative design of a new product with user feedback or testing. Also, health services co-design with patients, healthcare providers, and administrators to improve patient experience and health outcomes. Another example of co-design collaborative creation of public policy with citizens and stakeholders to ensure that the policy addresses their concerns and their needs. So what's the benefit from using co-design approach? It helps us to better understanding the user's needs, emotions, and to be more empathetic with them. Also, it helps us to create solutions that are more useful, effective, and user-centered. It helps us to increase user engagement and help earn buy-in. And finally, it promotes collaboration and stakeholders alignment. So let's move to let's proceed to the next slide. Here is just for your information, the Global Patient Safety Action Plan. and mainly the co-design methodology related to strategic objective number 4, which is related to patient and family engagement. Next, please. Here is the one of the quotation from the WHO Global Patient Safety Action Plan. Patient engagement and empowerment is perhaps the most powerful tool to improve patient safety. So co-design help us to empowering and involving the patient and to be more empathetic with them. Next, please. Now I will talk about one of the methods that were used in our project called design thinking. And design thinking, it's a non-linear process. It's an iterative process that help teams to understand their users, their challenge assumptions, to redefine problems and create innovative solutions to prototype and test. And next, please. As we see here in this picture, this is the framework for design thinking methodology. It's about 5 main phases. The first one called discover phase, and the second one generate large amount of ideas and choose the best one to go through the fourth phase. It's about experimentation. It's mainly help us to make prototypes for our solution and to get feedback and to design improvement products or services. And the fifth one about evolution, how we learn from our experience and what is the lessons learned. So in the step one, or in the first phase, we address the challenge and we research our users' need and to gain empathetic understanding of the problem that we are trying to solve. And typically through different tools as user research. So empathy is the most important mindset for design thinking, and it helps us to set assumptions about our real customer and about our their real needs. Okay. Next, please. So one of the challenge that we are working on it called inpatient discharge process. So we worked on it about a problem or challenge in discharge process, and we used design thinking, and the co-design was activated in improving the inpatient discharge process. Also, the patient involved in this improvement process through doing many interviews and collection of data and distributing different surveys for different types of patient and in different wards. As after that, we formulate patient journey maps to defining weaknesses and strength point and setting priorities for improvement. So this project took more than 3 months from the process of designing the challenge to the initial prototype, and also took more than 10 workshops with different peoples and those who are assigned for implementation. So the final outcome for this project, how might we improve the touch points that could be recognized and memorized by the discharged inpatient regarding their experience. Next, please. As you can see here in these pictures, it shows the way we work in our improvement projects using design thinking methodology. It mainly depends on flexible work and relying on teamwork and creative environment to using mobile team or sticky note, and it's mainly depends on visualization for ideas and discussions, and also learning from each other. Some of the interviews that were done with the various group of patients, of physicians, of nurses and experts, and these interviews help us to gain or to be more empathetic with our inpatients. And in the next slide, we will show some of the interviews quotation. And I would like to highlight the most important quotes from our patient and our doctors. For example, in the waiting rooms, the time, one of the patients said that the time is very long and there is ineffective communication. And also another patient mentioned that the nursing staff needs to develop their empathetic skills and to be more effective in the communication. And another patient mentioned that the discharge process is difficult and complex and need to be improved. Next, please. After we did the interviews, we translated as patient stories. Here is some examples for the number of patients that we create patient stories. There are 3 patients from oncology center, and 1 patient from cardiology, and 1 patient from surgical units, and the other patient from medical wards. One of the most important tools in design thinking called patient journey map or customer journey map. It's about visualize or representation of the main stages for the patient to go through when interacting with our company or our hospital. For example, from buying products online to access customer service on the phone. And also it helps us to create effective visual maps that reflect customers' journey through these channels. And there is a different customer journey maps or patient journey map. How we can create customer journey map? First of all, we need to define what is our persona, or who is our patient, or who is our customer. And we need to define or create a persona that represents our customer based on our market research, and this helps us to know more about about their needs and their gaps. After that, we need to decide what we need to measure through what is the goal we are trying to achieve through using this map. And the final step, we need to organize the touch point or the main stages, the main stages for the customer. And the touch point is any moment a customer interacts with our brand or our service or with our product. And it helps us really to know the real journey. And after that, we need to know every time that our customer engaging with our brand, and there is a goal-driven action behind it. And after that, we need to break down the customer journey in main stages or phases based on their needs and based on their journey. Next, please. Another project that we used co-design, it's called Advisory Council for Patients and Their Families. It aims to develop and improve patient engagement and experience. Also, it seeks to do by considering the perspectives of patients and their families, anticipating their needs, and paying attention to all details that can improve patient satisfaction during their treatment journey across the continuum of care. Also, it aims to listening to patient complaints and suggestions and to offering fast solutions whenever possible or considering them for future development plan. And it's help us really to bridge the gap between the healthcare providers and between the patient, and engaging them and empowering them in designing the healthcare services or products. Also, the last project that we used co-creation called My Health Board Project. It's a tool for communication between medical team and patient in different wards. It helps the patient to raise their awareness about their medical status, about their painful, about to measure painful, also about how to communicate with patient experience center or patient safety center or with the healthcare provider, and also to know the most important information about their medical team as doctors or nurses. And this is my last slide. Thank you for your listening. I hope it will cover or meet your expectation.
Thank you so much, Amal. It was quite an interesting methodology, how to use co-design in engaging patient in a real world of healthcare facilities. Now, we're gonna move to our last speaker, Melissa. Melissa, I think there is a talk that nothing about me without me. So I think you are the right person who could represent yourself and the patient in the coming slides. And we are really interested to see a lot of successful story from your side. The floor is yours, Melissa.
Thank you so much. Hello, everyone. And thank you to this incredible team of colleagues for inviting me to be here with you today. My name is Melissa Sheldrick. I am a member of Patients for Patient Safety Canada, and we're a group of volunteers who have experienced harm in healthcare. We collaborate with healthcare organizations, government agencies, educational facilities, in research, and anywhere really that we can share our stories and our expertise. You see, we hold a unique perspective that others do not, and this perspective is essential when co-designing improvement projects to make sure that there are no gaps. And I also work as patient and family advisor at the Institute for Safe Medication Practices Canada. And 3 weeks ago, I had the honor of presenting at the World Health Organization's World Patient Safety Conference in Geneva about the power of patient and provider collaboration. And I'm really pleased to be able to continue sharing that message here with you today. So I'm coming to you from Mississauga, Ontario, Canada, and would like to acknowledge that the present-day city of Mississauga as being part of the treaty and traditional territory of the Mississaugas of the Creditford First Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and Wyandot nations. We recognize these people and their ancestors as peoples who inhabited these lands since time immemorial. The city of Mississauga is home to many global Indigenous peoples. And I'd like to share with you some more information about the first people who inhabited the land that we now call Canada. Canada's Indigenous populations make up approximately 4% of our national population, and they are made up of people from First Nations, Inuit, and Métis communities. Many Indigenous people live in urban settings, but also in rural and remote areas across the country. These rural and remote areas can be difficult to access due to geographic hurdles, which causes significant barriers to food, clean water, and safe healthcare. And as Ioana mentioned at the beginning of the webinar, Saturday, September 30th, and also being recognized today across the country, is Truth and Reconciliation Day, a national day which commemorates the Indigenous children who were taken away from their families and sent to residential schools, where they were no longer allowed to retain their culture and traditions. We have so many examples in Canada of people from Indigenous communities who face racism and discrimination in every area of their life. healthcare, education, housing, poverty, etc. That's why, as part of the reconciliation process, a Truth and Reconciliation Commission was formed to investigate the full extent of the harm caused by residential schools, to propose solutions, and to prevent future abuse of Indigenous communities. And as a result, a report was created with 94 recommendations or calls to actions. The next slide, please. They wanted to advance the process of healing from the devastating effects of colonization. 8 of those recommendations are focused on healthcare because health is a basic human right. And First Nations, Inuit, and Métis people face terrible health disparities here in Canada. Due to the legacy of colonialism and systemic racism, Indigenous peoples are more likely than other Canadians to experience persistent poverty, food insecurity, and barriers to housing and education. And these social determinants of health are key contributors to chronic illnesses and other health challenges. But seeking medical care can be difficult as Indigenous people face a lack of health services, as I mentioned, particularly in rural and remote communities. They also experience anti-Indigenous racism in health systems, a lack of cultural safety, and a lack of an acceptance of Indigenous health and healing models. The next slide, please. But there's hope. There are so many efforts across Canada where healthcare providers are working with Indigenous communities to improve access to safe and quality healthcare. Committed professionals are willing to learn about Indigenous health traditions and culture, and together they are co-creating programs, systems, and resources. On the next slide, you will see 2 such resources. The 5 questions to ask about your medications on your left is a resource that was co-created with patients and healthcare professionals. The pamphlet was designed to help patients and caregivers know which questions to ask so they could seek the most important information about medications from a pharmacist, a nurse, a doctor. And these questions not only open up a dialogue about medications, but they really support improved safety. And this resource is available in more than 30 languages, and you can scan the QR code to download your free copy. The First Nations Health Authority in the province of British Columbia, Canada, is the health and wellness partner to over 200 diverse First Nations communities and citizens across BC. They wanted to use the 5 questions resource, but when they reviewed it with their community members, they discovered that a 6th question was needed to apply to their local needs. Together, they created this resource on the right, Medications Questions to Ask. We're going to hear a recorded presentation from 2 members of the team in British Columbia about how they developed this resource alongside First Nation community members. We can go ahead with the video.
Well, welcome to Indigenizing ISMP's 5 questions to ask. Dela Kesla, Nugu Bubasistu. Greetings. I'm a member of the Wewakai Nation by virtue of marriage, and my traditional name is Bubasistu, which means cat eyes. My everyday name is Candy Lee Chikite, and I'm a project analyst with the First Nations Health Authority on the Health Benefits and Services Pharmacy team.
And hello, everyone. My name is Turner Barrett. I'm a member of the Métis Nation of British Columbia. I'm also a registered pharmacist with a background in community pharmacy. Nowadays, I work for the First Nations Health Authority on the Health Benefits and Services team as a pharmacist, and I'm also currently an addiction pharmacy fellow with the BC Centre on Substance Use. So before we get into the content of our deck, we wanted to respectfully acknowledge the unceded ancestral and traditional territories of the Coast Salish peoples, particularly of the Musqueam, Squamish, and Tsleil-Waututh First Nations, where we're calling in from today and also where our office is situated. It's a privilege to work and especially to live and play on these territories.
And although I'm coming to you as a visitor in Coast Salish territory today, I hail from the unceded ancestral and traditional territory of the Likoto peoples on the mid-east coast of Vancouver Island. The First Nations Health Authority, or FNHA, is the health and wellness partner to over 200 diverse First Nations communities and citizens across British Columbia. In 2013, the FNHA began a new era in BC First Nations health governance and healthcare delivery by taking responsibility for the programs and services formerly delivered by Health Canada. Since then, the FNHA has been working to address service gaps through new partnerships, closer collaboration, health systems innovation, reform and redesign of health programs and services for individuals, families, communities, and nations. We've transformed health services for First Nations people in BC by integrating FNHA clients into the provincial drug benefits insurance program and improving ease of access to benefits and services. The FNHA is also a champion of culturally safe practices throughout the broader healthcare system. Taking a leadership role, the FNHA actively works with its health partners to embed cultural safety and humility into health service delivery and improve health outcomes for First Nations people.
As Kenny Lee alluded to, the administration of pharmacy benefits was transferred from the federal non-insured health benefits program to the provincial pharmacare program here in BC. FNHA clients access a specific plan in pharmacare called Plan W for wellness. It's a comprehensive plan, it's evidence-based, and it's 100% paid with no deductible. It's funded by FNHA, which enables us to make unique modifications to the plan based on needs identified by BC First Nations communities and individuals. As you can see, FNHA has also formed very close relationships with other provincial organizations. Bringing the design of program and service delivery closer to home means that BC healthcare providers no longer need to navigate a race-based parallel pathway for providing care to FNHA clients. It results in an experience that is better for the client, one that is more likely to be culturally safe.
And we understand the importance of listening to and respecting our clients' voices. And in response to suggestions heard through community engagement, client surveys, and governance caucus meetings, FNHA has published resources on various health and wellness campaigns and topics within the health benefits program. One of the common themes voiced is that accessing medication sometimes causes challenges. However, when we looked into it, the majority of the issues heard may well have been avoided if a conversation with the prescriber or a pharmacist had taken place first. So, in order to help facilitate those conversations, we decided to adapt ISMP's 5 questions to ask about your medications resource sheet to make it conducive for our purposes and created medications questions to ask. We engaged with a panel of First Nations clients and asked what questions would be helpful to discuss with a prescriber or a pharmacist. They offered suggestions on what they felt would resonate with their family, friends, and communities to access medications and promote healthy and safer medication use. We took what we heard and created a first draft of the document, making sure to set out the information more in a chronological flow of safe medication use, rather than putting any weight or importance on a topic by numbering it. We then took the first version out to nurses and other health professionals that work in First Nations communities. And solicited their feedback on the content and
One of the biggest modifications to the form was the addition of the questions surrounding medication coverage. We added this as we have heard from First Nation leaders that a big part of medication safety is med coverage.
This aligns with the social determinants of health. If a client is unable to get the medication due to a financial cost, then they may go without it, which often leads to further complications and severe or serious outcomes requiring higher levels of care.
We wanted to empower clients to ask about medication coverage if they wish to do so. Pharmacists in BC have several mechanisms to address med coverage issues, such as through medication adaptation, submission or assistance with special authority applications, or by collaborating with the rest of the provider's healthcare team. If the client prefers a covered option, pharmacists should be able to help. So this slide shows a large number of First Nation communities across BC, many of which are not situated in an urban area. The table on the right demonstrates how many rural and remote First Nations are multiple hour drives away from a pharmacy, sometimes on roads that are dangerous or even impassable at certain times of the year. Others are only accessible via boat or float plane. And I would imagine that rural or remote communities across Canada face similar issues. This actually brings us back to coverage. If a client lives far away from the pharmacy and there is an ongoing coverage issue at med pickup, it may result in the client returning home without the medication they need. As Kenny Lee mentioned, this can result in negative health outcomes, and it can also reinforce negative experiences that BC First Nations have faced when accessing the healthcare system.
First Nations perspective of health and wellness outlines the importance of balance between mental, emotional, spiritual, and physical health. These aspects of wellness, which include traditional medicines, are optimal when they're all nurtured together to create a holistic level of well-being. Ancestors and elders have kept traditional medicines alive through medication mapping, back-to-land medicine gathering, and knowledge transmission through oral history in order to have present-day books and workshops. Because of this, there are plants, bark, berries, and roots that have kept communities healthy for generations, and our clients wanted traditional medicines added to the resource.
Healthcare providers may feel as if they're in uncharted waters when discussing traditional medicines, as if there isn't an abundance of Western evidence. However, we do know that First Nation individuals have been using traditional methods of healing since long before colonization with beneficial effects. When clients do share this information with providers, they should not dismiss their usage. Rather, providers should acknowledge and respect a client's choice to use these medicines. And as always, remember that clients are the decision makers of their care. Providers who work closely with First Nation clients should also consider how they can connect with the local First Nation communities and collaborate with the local health service organizations to improve service delivery. Providers who make this effort may also be offered the privilege of learning more about traditional wellness. But remember, this information may be considered sacred and this should be respected. So I did want to quickly touch on the Indigenous Cultural Safety, Humility, and Anti-Racism Practice Standard, which pharmacists in BC are now accountable to meet since it was added to the Health Professions Act in September of 2022. All of the other professional regulators also have added this to the HPA, so it applies across the board for all healthcare professionals or regulated healthcare professionals in BC. Answering the questions on this sheet we created and empowering clients to make informed decisions is a step towards providing culturally safe care. Similar standards also exist for organizations such as the BC Health Standards Organization, British Columbia Cultural Safety and Humility Standard. This standard helps governing body members and organizational leaders identify, measure, and achieve culturally safe systems and services that better respond to the health and wellness priorities of Indigenous peoples and communities, regardless of where they are located. I also wanted to quickly introduce the concept of 2 online courses that UBC will be releasing soon. We supported with the development of these in response to First Nation leaders voicing concerns surrounding safety of pharmacy interactions for their community members. These were created with oversight and guidance from a First Nations advisory and pharmacy group, and incorporate designs created by a First Nations artist from Tikin Indian Band. The first course focuses on the importance of cultivating relationships with First Nation clients, and the second is a series of cases. They'll be free to access and hosted on UBC's electronic learning platform. If you're interested, keep an eye out for their release. They are BC specific, but the general concepts should be applicable Canada-wide.
Adapting the ISMP document and transforming it into something that resonates with FNHA clients may seem like small changes, but they have big impact. Adding the piece on coverage, traditional medicines, providing more finite detail in questions to consider asking, inserting a QR code to access more FNHA's health benefits information, including our drug plans, and a phone number for support from FNHA health benefits assessors, all lead to client empowerment and safer medication use. From the initial collaboration with our clients, through each stage to final product distribution, including this opportunity to share the work with you today. The voices of our clients have been amplified. We raise our hands in gratitude to those who provide services to Indigenous clients and urge you to reflect upon your work and determine if there's anything you can implement or change to improve their experience in safe medication access.
Thank you very much for listening.
Thank you. We can go to the next slide. So as you can see, the First Nations Health Authority was able to customize an existing resource for and with the needs of the communities they serve. Making small changes can mean big impact. Do you know of any existing resources that you could modify with your patients to support their safety and wellness? Thank you so much for having me today, for listening. I've put the QR codes up here that will take you to the video that we just watched, but also to ISMP Canada and Patients for Patient Safety Canada websites. Thank you so much.
Thank you so much, Melissa. I think that's quite impressive example that engaging patient in guidelines and policies is doable and achievable. And you're really sharing a very hands-on experience of how we can do it with patients. Actually, we are almost having a few minutes before closing our session, and we are encouraging our participants to share their questions. So until you gather your ideas and questions, I just have my own questions to my speakers. Let me start with Aiwana, since you have engaged patients and families with Canadian guide, Engaging Patient for Patient Safety. How you could just summarize this experience in terms of selecting the patients? Do you have any characteristics, or what kind of methodology you have?
Yeah, thank you. That's really a nice question. Thank you for asking this question, because we have used a quite unique approach with Patients for Patient Safety Canada. What we've done is we empowered the members of the group to form a participation requests committee. So the decision about which of our members participate in any project was not with me or any one of my colleagues. Sure, we guided and wanted to make sure we have the right person, but it was the decision of the members of Patients for Patient Safety Canada of who from their group will participate, because they know everybody's story, they know everybody's interests. So giving the power to them to help make decision was key, and it was for 15 years, and it continues to be one of the driving forces. The benefit of that is that we always have new members who participate in our work. It's not the same people that we are comfortable with. I told you about comfort. Comfort is not good. You need to find the discomfort in order to grow and improve. So thank you for the question. I can share a lot more for those who are interested at a different time.
Thank you so much, Iwan. For you, Melissa, how about the 5 questions, which you said that it was actually based and developed in a specific way, but when it comes to British Columbia, they customize to their customer. And sometimes our healthcare providers just commenting on that is it a validated tool that we can just tailor it to our customers and customize to their needs?
Thank you for that important question. I would draw our audience back to the original 5 questions to ask. It's been endorsed over 200 times internationally. So it really is a great foundation for anybody around the world to take and look at their local needs and customize it. It might be just as simple as a translation that exists or that doesn't exist yet. And we are always open to suggestions for translations. And it could mean adding to it or taking out some information according to the needs of the community. So for example, we see in British Columbia that they added that important question about financial financial needs, because if the medication is not covered, the patient will not take it, and then their healthcare is compromised. So perhaps there's a different question that applies in a different community and it can be changed. Perhaps the original resource has too many words and it needs to be simplified. So you can change it that way. So there's so many different ways that that particular resource can be adapted. I think it's just so important to really work with the community that it's for in order to really dig deep and find out what it is that's necessary for them to enhance the safety of their medications and of their healthcare.
Thank you, Melissa. And even for inviting us for a translation as a patient advocate, I'm in. So
Okay.
we're going to communicate
Excellent.
regarding this. Thank you so much.
Wonderful.
Actually, our last questions for Amal from Dr. Reem. How to utilize innovation in a conventional patient safety unit in a hospital? Even you, Aiwana and Melissa, if you have any input, but let's start with our expert, Amal.
Okay, thank you, Ms. Makia, and thank you for Ms. Reem for her question. First of all, innovation, it should be a mandatory, and it should be it's need a leadership support to be implemented in healthcare sector, especially for patient safety and for patient experience. And it also need to be a different stakeholders or different background from different administration to build a valid and to meet the needs for the patient. As I mentioned in my talk, innovation in healthcare, it's about a framework, and it's help us to understand the real experience for our patient through different tools or through different phases or milestone. It needs to started by research and by interviews, and it's need to have or it's need to be more empathetic with your patient or with your stakeholders. And also we need to collaborate with different skills and with different point of views from, for example, from the operation or from the quality or from the administration or from also from the top management or from the external stakeholders that help us to think outside of the box and to see the alternative ways to view the problems and to identify innovative solutions to the problem. So it's really need to be emphasized from the leadership, to be implemented from the different administrations and from different team members.
Thank you, Amal, for your answer. Aiwana, do you have anything to add?
Yes, I will add that innovative methods of engagement can create positive energy and curiosity and helps people change their mindsets. So I would say, sure, if there is buy-in and people are willing to do so, include them in addition to or to complement the traditional ways of engagement. It will generate new ideas.
That's really impressive, and I think encouraging everyone to just start a step, as you said. My last question to all the three speakers, if you can just summarize how you could describe the patient responses and feedback when they are interacting or engaging in any improvement project related to patient safety. How could you just summarize their interactions and responses? Could we start with Amal? How did you find your experience?
Okay, I think patient is a source of innovation, really. It helps us to know what's going on the real and their experience, and we need to hear their voices also in our decision making or in our meetings with top management to know what they want and how we meet their expectations regarding their the hospital services and their hospitalization in our healthcare sector. So they are really important part in healthcare system, and we need to engaging them and empowering them in all of our projects or policies or procedures.
Thank you, Amal. How about you, Aywana? How did you find, from your own experience, whenever you engage patient in any patient safety project, how was their feedback and their responses?
Yeah, maybe I'll pass this over to Melissa to answer first.
Okay.
Thank you. We patients are more than happy to support in co-designing these projects. Those of us who have experienced harm in healthcare, when we are engaged in improvement, it values the journey that we've been on. And that value and that learning that we've been through is something that cannot be brought to the table by anybody else. A patient lens is unique. Every person's experience is unique. And when it's missing in improvement, there's a gap. There's a gap that can't be otherwise filled. So inviting people to the table, people with lived experience, is extremely important, and it is always beneficial to the team. Sometimes it's not comfortable. Sometimes you experience things and you hear things that are not comfortable, but that's what truly guides the way forward and the innovation.
Thank you, Melissa. Well said. I'll just add that as staff who facilitated engagement, this was the best job in the world. I felt that I worked with heroes every day, people who have been through the most unimaginable pain, but they came to help us make the system better. I have quotes and beautiful messages from all the patient partners I worked with over the years, and I consider them as my dearest collaborators. When I get an email from them, it brings joy in my life, and it's always positive. Thank you for helping me with the presentation. Thank you for being behind the scenes as I was getting ready to do, a contribution, a significant contribution. So as staff, I promise you, when you do engagement, even when it's hard, it's the best job possible.
Thank you for adding the word hard, because I have heard it myself, that it's very hard to bring a perspective of patients. Some of our healthcare providers are in fear that they might just be resistant. They might be blaming us all the time that we are not doing our best. So, as you said, it's hard, but it's an interesting work to do. Thank you so much. I think we ran out of time, but it was really quite an interesting webinar. On behalf of Saudi Patient Safety Center, I would like to thank you, our speakers. It was really an interesting topic with a real experience and hands-on lessons learned. Thank you, our audience. And I would like just to ask you, our speaker, if you have any final remarks to close.
I would just add, if you want to hear, I would love to hear about your successes and your challenges. Let's stay in touch.
Thank you. How about you, Melissa?
Thank you. Just reach out in your community and ask if there's somebody who's willing to step up to the table, and I can almost guarantee that there will. So I look forward to staying connected to the Patient Safety Center and also to audience members. Thank you so much.
Thank you, Melissa. How about you, Amal?
Thank you for you all. Really, it's an impressive presentation from all speakers, and thank you for our audience. And I hope they can lead the innovation in their organizations, and they can implement it in their innovation, patient safety and patient experience projects using design thinking or any other methodology that's related to creation. Thank you.
Thank you, Amal. Thank you for joining us today, and we look forward to welcome you back in the future webinars. Thank you and see you all.
Bye, everybody.
Good day.